We have our x-rays. We have our x-rays before and after where we see a change in her cervical spine. We see things on that x-ray that we didn't even sure we were able to achieve because of the fusion. But it's because she had hope, because she was committed, and heck, no one was going to stand in her way to getting some change. Now, the problem is, because her spine was fused, her pain's never going to leave, right?
Right, yeah.
But she went from like a 10 out of 10 pain on a daily basis to down to a numbing, dull pain, where she came in one day and she was just like, I completed my paperwork without having to stop. I could look down at my paperwork. So here she is in her mid-80s, seeing things on x-rays that you shouldn't see in an old person's x-rays, let's be completely honest, like all that wear and tear. And then I have, I had another woman at that time who came in and every day was focused on the negative things, on the stress. She wasn't committed. She wasn't following through with the recommendations. We told her that, like, hey, the fact that you're eating these things at home is going to cause inflammation. So here this woman is, early 40s. We can't budge her spine.
Right.
We can't do anything with her pain. But then here we have Judy in her mid-80s seeing changes. Why can one person get well and the other person cannot if we do the same things? And it's all about your mindset.
Yeah.
It's all about what you think is possible. Mm-hmm. It's all about your commitment. When someone comes into the office, and that's why, man, to become a part of our practice, to become a coaching client, it is a process. Because we want to make sure you're not wasting your time and money. I don't want to waste my time if you're not 100% committed. Because we know that once you're committed, we know that once you step out of fear and you step into hope, we know that once you educate yourself, we know that once you empower yourself with the right information and you stand up for yourself, what is possible will change. I have another woman right now, I'm virtually coaching her, who came in pre-diabetic. She's only like late 30s, so she's probably about 37, 38, right? Pre-diabetic. She had, she had something, I think it was like an IUD or an injection. No, it was an injection. It was the depot injection that she had injected into her in her early 20s. And from there, she started having crazy hormone issues. I mean, we're not talking about hormone issues as in like her period was bad. We're talking about after, like right before her period, a week and a half, she was so severely depressed. She was so anxious. She literally, her husband knew when she's in that, you leave her alone. Her kids had to go into another room. She was locked in her room every single cycle the week before her period. But she knew, she said, okay, I can, because what they wanted to do is they wanted to put her on, I think it was something to affect her ovulation. At that point, she said, if I'm feeling this way, there's a reason. And I don't want to be dependent on more medication. She was already on 3 medications. She's like, I have to get better. The doctor said it was impossible. She has PMDD. That's just what she has. Came into my office. In a 4-month period, she's lost 40 pounds. She's come off of her progesterone. She's come off of her metformin. And now her doctor's working with her because of everything she's done with me to come off her antidepressant. That doesn't just happen by saying, I think I'm going to check out these doctors. I just want to treat my depression. No, that happens when you say, I'm tired, I'm done, I'm drawing a line in the sand, I'm going to get well. Because I don't want to do what? I don't want more medications. I don't want more doctor visits. I want to get well. And that's when we see that. When you go from this place of fear to hope. When you go from hopelessness to knowing that you can do this. So today we're going to be talking about gut. We're going to be talking about acid reflux. We're going to talk about these gut symptoms that y'all are living with and not realizing the bigger picture of what's happening inside your body. What's causing these symptoms that are going to wreck your immune system, your brain health, your overall autoimmunity status, your ability to bounce back, your ability to be well, your skin health, your pain levels. That's what we're going to talk about. But if you're listening to this and that's you and you're like, you know what, I'm tired. Like, I want to draw a line in the sand. I want to be like Judy. I want to be like my client that right now is just seeing some completely different changes in her health in regards to weight loss and hormone health. You can give us a call at 423-362-5360. You can talk with our team about what it looks like to come into the office and to work with us. Now, listen, If you want someone to treat your symptoms, you have plenty of people in your city. You have plenty of people here in Chattanooga that will love to treat your symptoms. Come on, guys. There's like quote-unquote holistic nurse practitioners that will give you anything you need to see your labs change. But if you want to get down to the cause and see a lifestyle change, something that will change your life 5 years down the road, check us out either at doctorswarren.com or give us a call at 423-362-5360.
Yep.
So let's talk about that gut stuff.
Yeah. So like I picked out the symptoms that I think are something that a lot of people deal with on a regular basis, at least one of them. So, talking about reflux and talking about, bloating and talking about gas, right? Some of these more uncomfortable type of things, like, where you're maybe a person who you eat a meal and then 2 minutes later you're like, holy moly, like I can't even stand up because I'm so bloated, or my pants are tighter already because I'm bloated, or again you talk about, I can't drink coffee, I can't drink wine, I can't have I can't eat chocolate, I can't have all these different things because of my reflux, like spicy food, it gets me. Which I also sometimes see would be like, yeah, but my dad and my mom, they couldn't eat spicy food either. So it's like, I'm like, no, you guys had all the same environment. You grew up together, which means you got the same gut, which is giving you all the problems to begin with. So that being said, these symptoms are signs of underlying root issues that if they stay in effect for years will shut down the digestive system. And I say that in all seriousness because I'm dealing with more patients now than I think we ever have, in the past, 6, 7, 8 years, that have things like gastroparesis, and they're literally their nervous system to their gut is just, it's done, right? It's paralyzed. It doesn't work. I'm seeing more and more people that have, they can't move the food and the bacteria out of the upper intestine anymore on their own. And it's becoming, it's ages across the board too. I'm dealing with a woman who's in her late 70s who has major issues with that. And it's every 3 months, 4 months, she ends up in the emergency room because she can't stop, throwing up, because literally it's her digestive system, is not working. And then I have another 42-year-old who's doing the same thing. And yet then I'm seeing kids that have similar problems. And it's all those symptoms right there that lead to gastroparesis are all because of overgrowth, right? Overgrowth issues. So why are we seeing such a major explosion in overgrowth issues in the gut? It is because of, again, environment and lifestyle. If you think about it just for a second, you're not going to run into very many individuals who say, I've never had an antibiotic. Right? You're just not going to hear that said. You're not going to run into anybody who says, well, no, I have never eaten food that has pesticides or herbicides on it. So you're not going to see that. So guess what? You're going to see, the majority of a population have major gut issues, specifically overgrowth, because of the environment that we created for our kids, for ourselves. And so we're going to dive into that today, and we're going to dive into, what to look for, how to find out, what to do, what's the solutions for it. Even some simple things you can do right now. So I know we got to take a break. And when we get back, guys, we will make sure that we dive into the gut, in depth. If you want more information about us, go to doctorswarren.com, DRSWARREN.com. And you can actually sign up for our newsletter there. It's actually pretty simple. Newsletter we send out every single week. We're sending out our radio show from the previous week, so that way you can listen to that. What's new in our world. We're talking about different articles that we've written, and try to keep you guys up to date on all the latest and greatest. Not only research but what's going on in the health realm. So doctorswarren.com, sign up for the newsletter. And everything, and get all the latest, greatest health information. So this is Wellness Radio with Dr. Nathan Warren and Dr. Rebecca Warren. We'll be right back after the break. All right.
So we're going to talk about gut health, because this is, okay, what I want to do, I'm going to go a little bit deeper on this because we have to address this fact. And we're seeing a lot of children that are having serious gut issues. And I actually have women
too. Like UTIs can be a gut issue.
Colic,
ear infections, all of these
not
things.
Not being able to poop.
Yeah.
Let me go ahead and tell you this. Even if they're nursing, they still have to poop. There are saccharides in there that are undigested that move the colon in a child. And then we have kids that are not pooping. Babies that are not pooping for days at a time. And doctors are incorrect in saying that this is normal because they're not having any waste. No, there are lots of saccharides in breast milk that babies should be pooping out. But where does this come from? Because what I want to address is that, I'll tell you what, a majority of the moms and dads, the parents that bring in their babies in for gut issues have already done a lot of really great stuff. Or they're, for the most part, healthy or have changed things in their environment. So they're shocked. They're sitting there and they're like, how is my toddler having constipation or colic or ear infection? Why is this happening?
Or eczema.
Eczema. Oh my gosh. How many kids we see with eczema, right? The problem is this. And anytime I talk to a mom about this, they're like, they get it, okay? A baby will get they get seeding from their gut microbiome 3 different ways, okay? They get it in utero, aka they get their gut microbiome from mom, okay? In utero, they get it when they're born vaginally. And if they're not born vaginally, if they're born C-sections, then the lack of vaginal bacteria that's seeding in their body, their body's looking for bacteria, and more often than not, studies have found that they pick up bacteria in the OR, okay? And then third is through breastfeeding. So this linear relationship. There's 3 different ways where a mom is giving the bacteria to the child. So how is it that a baby has such a bad microbiome? Why are they having eczema and colic and ear infections? It's because 9 times out of 10, when I talk to the mom, what do parents usually do? They put kids first, right? They get healthy during the pregnancy, they pour into the baby, and then when I ask them, have you worked on your gut? How do you think your gut is? And 9 times out of 10, they're like, it's not well. Well, they get the gut issues from mom. And then from there, they're more sensitive. They can show those symptoms more. Yeah. That's where it comes from.
Yeah, that's a good point too. I mean, it's hard to see it though, right? Like it's hard to imagine that. We're about to go live again, guys. All right, guys, welcome back to Wellness Radio. I'm your health expert, Dr. Nathan Warren, and I'm here with my beautiful wife, Dr. Rebecca Warren, and we were talking about really kind of leaning in the categories of like reflux and bloating and gas and some of these digestive issues that, a lot of people just take over the counter, don't think it's a big deal, but we're seeing it, kind of rampant. Like we were just talking about, in kids, and Dr. Rebecca was just talking about in babies, because we're seeing it more and more. Like, I'm not even gonna lie. I know for a fact that I go back 3 years or even 4 years. I could take a kid with like eczema and probably 4 weeks, get them to a point where like 90% better. It's not the case anymore, man. Like it's getting worse and worse, where like, you're finding like overgrowth of bacteria that are very resistant to, to treatment in general. You're finding, children that have, had wrecked guts literally since day one, and kind of a breeding ground for like bacteria that really is supposed to be more on the skin or on the surface, have inoculated the gut, and it does it. It's a game changer. It makes it much harder. And I think when you see these kids hit in their 20s and 30s, like the amount of irritable bowel syndrome, the amount of Crohn's disease, the amount of ulcerative colitis, the amount of gastroparesis, the amount of these chronic gut inflammatory issues, I think are gonna skyrocket.
Yeah. And I want to go ahead, and if you're listening to this, I'm going to go ahead and hit some myths, okay? So if you're listening to this, we are Doctors Warren, the Wellness Radio. We're here 2 hours every Saturday morning. You can find us on Facebook at Doctors Warren, or go to doctorswarren.com to see how we can help you. You can book a consult through our website as well. But let me go to take some myths out of the way. You can have a gut issue and not have a gut symptom.
Yep.
Show up. right at the beginning.
And by
right?
that you mean like how you poop, how your stomach feels.
You don't have to have acid reflux.
Yeah.
You don't have to have like, I don't notice bloating. If you have skin issues, if you have autoimmune issues, you can have migraine headaches. You can have, fatigue issues. You can have low testosterone. You can have thyroid issues.
Memory problems.
You can have memory problems. You can have depression. You can have anxiety. And those can be your first symptom when it comes to a gut issue, okay? So that's the first myth I want to go ahead and take off the table. Number 2, long-term antacids are always going to make your problem worse. The second myth I want to go ahead and touch on is that what we have seen is that you are treated as if you have too much stomach acid for why you have your acid reflux. But in all honesty, what studies are showing is that it's not that you have too much, is that you have too little.
Yeah.
So now you're taking these medications or these over-the-counter things that are decreasing your stomach acid, and what studies have shown is 2 different things. It makes you dependent on the antacid moving out in the future, and number 2, it causes more serious issues. The third myth I want to touch on is, but I get a colonoscopy every 5 years, or I get it every couple of years. Listen, a colonoscopy is looking for what? It's looking for a problem that's already there. I have
cancer, polyps.
Yeah, so on our website, on our website at doctorswarren.com, you can look under the testimonials. And we have a testimonial there of a woman who came in. It's her whole family's under care, right? And she came in older because for some reason doctors think that once you're past 60, you can't change anything. So she came in. And she had bloating in her stomach. But the number one thing is that she'd been on thyroid medication and she was in a lot of pain. So she just wanted to figure out, make sure her thyroid's fine and decrease her pain. Let me go ahead and tell you what happened. She's gone on the lowest dose of thyroid medication she has ever been on. Her pain, she's come off pain medication, all right? 3 different pain medications she's come off on. She had skin lesions that started falling off her skin. She was like, I don't know what that was. And I'm like, I don't know what it is either. But they were falling off because her body was healing. And she lost 30 pounds. What I found in her gut is that she had H. pylori overgrowth, meaning a type of bacteria that created an autoimmune reaction systemically, wrecking her immune system, causing other autoimmune issues that were showing up in her skin that she was struggling with her pain. And when I showed her her results, the overgrowth was so high. And when I showed her her results, she sat there and she goes, I just had my colonoscopy and they didn't find anything. Yes, because the colonoscopy is going to find what? It's going to find things once it's already there. That's already there. It's going to find disease. Yep. Do you want to wait around until someone finds cancer in your digestive system to do something about it?
It's already billions of cells strong by that time,
right? At that time, if you have ulcers, the H. pylori she had causes ulcer. So if we did not address it, guess what was going to show up on our next colonoscopy and then after that? So the colonoscopy is looking at disease that's already there. When we're looking at the stool testing, when we're looking at systemic testing, when we're doing the right test, when we're looking at your health history, we're not looking at what disease is already there. Although if you do have those issues, we can help. But what we're looking at is what can this lead to.
Yes.
So I just wanted to get the colonoscopy out of the way because a lot of you guys are doing colonoscopy and from one colonoscopy to the next, you're shocked as to why there's polyps.
Yeah.
Well, I can tell you why there's polyps if you do the right test.
Well, and it's looking at, like colonoscopy, think of it as looking at macro environment. When in reality, you want to find out what's causing that macro environment, which is the micro environment, right? It's the micro environment that we have to really, focus on and pay attention to, and that's what creates that bigger view there. So when you think about like what's creating the ulceration, what's creating the cancer, what's creating those things. And also too, no, it's genetic, right? No, it's genetic. My genes are. What do you think turns on your genes, right? Like, we know for a fact, like everybody's so scared of like viruses as an example. They think that viruses are so scary. Did you know that viruses, like you need viruses to actually express genes? Like these viruses inside of our body actually help us with our gene expression, which is actually why I buy more into, the viral theory that viruses, not only their information that goes from environment to human being to help with adaptation, and those that are not able to adapt very well, they die, right? Like it's just, honestly, it's common sense. Viruses, we've known, they're not alive, they're not dead, right? It's information. So it's information going from environment to human being to help with adaptation. And again, if you have a failure to adapt, then yeah, it kills you. So that's why at the beginning of the show I talk so much about, our whole goal is to get our body, as healthy as it can, so it can deal with as much as it can, overall. So we want to make sure that we're doing that, and understanding that the microenvironment is absolutely huge. Like if you have something like H. pylori overgrowth, or you have, diagnosed SIBO, and all your doctor's doing is going after like the reflux that is the symptom, guys, you are absolutely asking for disease and early death. Like there's no other way around it. Like you take something like SIBO and you leave it in a human being for 30 years, it shuts down your digestive processes. Not sometimes, all the time. It shuts it down. It damages the migrating motor complex that pushes food and bacteria out, and you're diagnosed with gastroparesis, and then your doctor says, oh, we just don't know, I guess it just happened to you. And then you think the rest of the time that, oh, it was, bad luck. It wasn't bad luck. It's overgrowth over the course of 30 years. The H. pylori, we've known how many years now? And they, by the way, they tried to destroy the doctor who, suggested that H. pylori could be a cause of ulceration and even certain types of cancer. They tried to destroy his career until years later they're like, oh yeah, that's right, this guy's right. Or like, remember the doctor that suggested, oh my gosh, wash your hands before you deliver babies? And they literally, the guy ended up committing suicide. Because of the way they ruined his reputation, his life, and everything. And he saved, probably at this point, what would you say, hundreds of millions of lives by suggesting that, physicians maybe should wash their hands in between delivering babies.
If you're waiting around for studies to confirm or deny, you're going to be waiting around for a long time, because it's not just the right studies that are being done, but it also has to do with whether doctors are implementing the newest studies in clinical practice, which they're not. Unless you're Pfizer or Moderna, then you don't really have to do science. You can just get like emergency authorization use, and you're good to go. You're fine there. So you don't have to rely on science if you get it that way. So that. We can go into, anyway, we could go into a whole nother thing with that. So the one thing I also want to point out that, let me go ahead and tell you this has happened with multiple supplements, where you hear that it's good, so everyone goes and does it with that, and then everyone does it too much, and it causes problems. It's happening with vitamin D, it happened with omegas. But let's talk about probiotics, because I'm going to post on our Doctors Warren Facebook page, I'm going to post a stool test that I did of someone whose doctor had them take $100 probiotics every single month. Okay, every single month. And when I did her stool test, it was 150. Like, she told me this brand. I looked it up because I'd never heard of it. I'm like, wow, I hope this probiotic's really intense. And then I did her stool test, and when I showed it to her, she was so shocked that I immediately asked her if I could share her results, because she was completely deficient. You guys think that going to Walmart or going to Vitamin Shop and getting a probiotic is going to fix all of your issues. But let me go ahead and tell you this. The gut microbiome is way too diverse. It's way too diverse. It's too diverse that studies can't even, they're just scratching the surface of what's going on in the gut microbiome. So a lot of you guys have small intestinal bowel overgrowth. You have a histamine issue. You probably have some genetic SNPs. You're taking probiotics without realizing that it's putting gas to a fire, right? Gas to a fire. There's a lot of you guys that are taking probiotics that are not getting to the gut. So you're wasting your money. You're taking probiotics that don't have the right strands for what you need. So the supplementation with the wrong things are going to be an issue if you have gut problems. Now we have to go on break here. When we come back, we're going to talk about what that means in regards to probiotics and all of that. If you're listening to this and you want to get down to your gut health, there's 2 different ways that you can work with us. You can give the team a call, 423-362 5360. They're there to answer your questions about making a consult with myself or Dr. Nathan. Or you can go to drswarren.com and you can read there about what it looks like to set up a consult and schedule it on our website at drswarren.com. This is the Wellness Radio. We'll see you right after the break.
All right.
I wanted to say this.
Go ahead. We have a question
Before we move on.
Okay.
Two things. Someone asked a question about coming off a fast, which I say we'll do a special video at the end of this, so you guys can have that video about coming off the fast, because there's about 30 people that are fasting right now.
Yep.
30. Well, no, they just finished.
And I'll say this is much different than last year. There were a lot of people this year that had prepared their bodies for the fast. So, like, there were a lot of people that were like, man, actually, like, as I'm adjusting them in the office or hearing from them on Facebook, they're like, I felt pretty good through this fast. Like, I'm doing really well. I'm like, wow, it's a lot different than last year. You know, last year it was like a lot of people were gung-ho about it. But man, like 2 days in, I'm like trying to, like, I'm talking people, you know, off the ledge, like, guys, it's okay, like, you're gonna make it. Like, it was like constantly having to remind them, you're okay, you can fast, you know, for 5 days, you're gonna be all right. Like, most of you could probably fast for 6 months and be okay. But don't do that, by the way. Yeah. But that being said, like, this time around, it was pretty fun. Like, people are like, man, you know what? Like, I've been kind of, you know, eating, you know, cyclical keto and going in and out of ketosis. So, like, going into my fast, it was actually so much easier. And then also too, like, I always love, man, when people fast, and getting to see, like, oh, I've got, like, you know, this pain showing up here in my arm or in my foot or in my low back, and then getting to see, like, 2 weeks later where they're like, oh my gosh, my back hasn't felt this good in, like, years, because they get the concept. Then they get to physically connect the concept of, like, problems getting, you know, like damaged tissue in the body getting broken down, in order to then see those stem cells come in there and actually, you know, do the healing and repairing. So you get to physically experience that. So, like, right now, I've got a few patients that are like, man, like, I'm on fire in a couple of different areas, and then they're going to see in a couple weeks where they're like, man, that area feels amazing, right? And pretty cool stuff. So
we'll do a video just to confirm with everyone what to do the next couple of days. And then we had another comment which got me really excited, with Mallory. She made a comment about how to prepare for a healthy pregnancy. And I commented right there, I'm going to do a whole live on this tomorrow. That is an amazing topic. So keep an eye out. I'm going to make a post that I'm going to do it tomorrow, at what time I'm going to do it, because this is a big conversation I'm having with a lot of the younger, more like, you know, ready to have baby women that I'm coaching, is how to prepare for pregnancy. So I'm going to do a whole live on this tomorrow evening. Keep an eye out. Make sure you share.
Get your husbands on it too, because they play a bigger role than I think most people think they do.
Yeah. So we'll discuss all of that tomorrow. But tomorrow evening I'm going to do that because I really love this topic. A colleague, a good friend of mine, is writing a book called The Healthy Human, like raising a healthy human or something like that. And this is literally what we've been talking about for months, is just how we can encourage and help women prepare for pregnancy. But this is what I want to let you know, and we'll move on to the next thing, is when I help women prepare for pregnancy, I don't do it for fertility. I do it for their wellness. I help women get well, and the side effect is if they want to get pregnant, they can. So tomorrow night.
It's really, really good. I like that mindset. Much better. All right, guys, welcome back to Wellness Radio. I am your health expert, Dr. Nathan Warren. I'm here with my beautiful wife, Dr. Rebecca Warren. So in the break, right, we were talking a little bit about, like, we're going to be doing a couple special Facebook lives over the next, couple days. Like, I'm going to be talking about, breaking the fast and everything, because we just had you guys on the radio that didn't hear this. We just had 30 to 40 people that just went through a 5-day water fast. If that sounds crazy to you, man, come join the craziness and find out why that's so absolutely amazing. One of the best things on the planet that you can do. And if your doctor tells you it's not, it's because they don't know and they haven't been educated on what real health is. But anyway, it was a lot of fun getting to see people do that. So we're going to be going over what to do as you're breaking the fast, coming off of the fast. What's the ideal diet to consume post-fasting? I think that's a really, really big topic. And then tomorrow night, Dr. Rebecca just talked about how she's going to talk about preparing for a healthy pregnancy. So maybe you have, maybe it's your daughter, maybe it's your daughter-in-law, maybe it's your sister or your spouse or whoever it is as you're listening to this that's thinking about, getting pregnant or having a baby. Maybe they've struggled with getting pregnant, which, again, that's only getting worse. Like that, you want to talk about dramatic uprise in fertility issues over the last 10, 15 years. It's probably one of the fastest growing things, as far as like chronic disease issues on the planet is infertility, which is not a good thing.
One thing I am going to talk about is miscarriages. I have worked with a lot of women here recently on miscarriages, so I want to address that as well. So tomorrow, go to doctorswarren.com. We'll send you a reminder. It'll be on our Facebook page where I'll be going live at Doctors Warren.
The question is, what time are you going to do that? Because tomorrow's the Super Bowl.
Oh, whoa! As you can tell, I'm so into the Super Bowl. You said it was at 4, though.
I don't know what time it is.
Are you?
It's somewhere around in there.
Okay.
We'll post a good time.
Maybe it'll be Monday. I don't know. Listen, I don't do the I do the Super Bowl for 2 different things. Like the Super Bowl halftime show, I started doing it when Beyonce was on there.
Oh my
and
God.
Also, I love football food. I love healthified. I make everything paleo. I make my own chicken wings. Listen, one time we had
chicken wings naturally paleo?
No, not if you do like a sugar oil buffalo. Like, what are you talking about?
Sauce, yeah.
But one time we had a friend come over for like the college playoffs or whatever, and he walked in and he saw my spread and he's like, is someone else, like, are more people coming? And I was like, no, it's just us 3. So we'll see. We'll confirm with that. But if you guys are listening to this and you're like, man, we're going to keep on talking about this the second hour. So you can do a few different things if you want to keep on listening to this. Number 1, sign up for our newsletter at Super Bowl starts at 6:30.
Thanks, Tim.
I told you
6:30.
that. Anyways.
Maybe you can do it right before or something.
No, I gotta be cooking. Okay, so a few things you can do is, number 1, go to doctorswarren.com and sign up for our newsletter. We have specials and coupons, but we are gonna give you our episode so that you can jump around and listen to the part you want to listen to. Follow us on Doctors Warren and doctorswarren.com on Facebook. But if you want to make an appointment or if you want to see how we can help you, you can do 2 different things. Call our team right now. They're gonna answer your questions. They're gonna let you know exactly what it looks like to sit down with us to actually start getting well. Or go to our website, doctorswarren.com, and click to make a consult there. We will be coming back for our second hour, so stick with us. This is the Wellness Radio. We'll see you right after the break.
All right, guys. So, as we dive back into the gut stuff, like, I think when we're looking at, something like, let's kind of start with major causes, so that way you guys know, because that's always the number one way, right, to address this. Like, I found that 80%, maybe 85% of gut issues, and people would take the foundational steps and just stick with them for a year, 2 years, 3 years, right, consistently. Like, you're going to see your body kind of naturally rebound and reset. That's why the foundations are always the most important. That's why when we look at, like, eating a good nutritional diet, like, it's not like an either or. It's not like, oh, I'm just going to, take these supplements and I don't have to eat that great, right? Or like, I'm going to take these digestive enzymes, but I'm going to still eat, rancid fat or like, sugar cookies once every couple weeks. Like, here's what you have to understand is that the nutrition we put in our bodies is a foundation. It's not a medication. It's not something that you just do every now and then when you're sick or when you got, no. It's literally a foundation of life. And so that and movement and the air that we breathe and the getting out into nature and the, taking care of your nervous system and those things are like, they're literally essential to life. And just by doing those alone, over time, not over 2 weeks, not over 6 months, but over time, like you're going to see the biggest shift in your health. And I think we have to focus on that sometimes because I think that gets lost. When we talk about like healing the gut and working on the gut, everybody wants to know what's the latest protocols to do. What's the supplement that's going to fix this? Which, by the way, just so you guys know, in the realm of supplements to fix a gut issue, it's not what's the 1 or 2 supplements to take. Listen, you to fix certain problems, like to fix something like H. pylori or SIBO, or it's going to take a multitude of an array of supplements to work on that issue. But if the foundations aren't set, none of it matters. It doesn't even matter. And so we got to make sure that we really are nailing down those foundations first. And when you have that going, now we can step into the realm of supplementation and what's appropriate, when is it appropriate, and everything like that.
So what is the foundation for starting to get your gut healing? There's a few things that you guys have to understand. So when we talk about nutrition, and it's not just nutrition, it's the toxins we're exposed to and a million other things. But when we talk about nutrition, nutrition is never going to heal you. Food is not medicine.
That's right.
And if food were medicine, then the lack of food, all the healing that happens when you're fasting wouldn't happen. So the food aspect is this. We, in our coaching and all of this, myself and Dr. Nathan, want to take away all of the pressure we put on food, all of the ideas, all of the things. Like, one thing that annoys me is, like, if you want, you can Google 10 foods to heal the thyroid, 10 foods to boost testosterone, 10 foods to boost progesterone. Listen, when I was a patient before I was a doctor, I felt overwhelmed. I was like, well, I have to eat blueberries for this, but I also have to eat pomegranate for this, but I also have to eat Brussels sprouts for my thyroid. And the truth is this, none of that is ever going to heal you. It's all about, at its basic, if you have diversity in your food, if you eat with as close to the seasons and as locally as you can, and if you eat the way God created us to eat, for the most part, you're going to get all of those superfoods and stuff like that.
Most on the list, by the way, are like the same things. Right? Like,
they are.
The same thing that's going to help your thyroid is going to be the same thing that's going to help your gut. It's going to be the same thing that helps your brain. It's going to be the same thing that helps because it's real food.
Yes, exactly. And so, on its most basic, when it comes to food, you have to view it as fuel. If I have a Ferrari and I'm doing 87 fuel, which maybe might be bad for a Ferrari, and the Ferrari isn't functioning well, and then all of a sudden you decide to give it the best, highest quality for your Ferrari, and your Ferrari starts functioning well, you would never say the gasoline fixed the car. You would say my car is functioning better because it has better gas in it.
It has real.
It has real gas.
Mm-hmm. Yeah.
I don't know.
No,
He was looking at us. Okay.
Yeah.
So, there we go. So we're going to jump into this more. Let's talk about the basics and then how to build on the basics when it comes to gut healing.
All right, guys. Welcome to Wellness Radio. I'm your health expert, Dr. Nathan Warren. I'm here with my beautiful wife, Dr. Rebecca Warren. We're talking about gut, reflux, bloating, gas. Are you having any of those issues? Because that's what we're going to be talking about throughout this whole thing. So we want to make sure that we are diving into all that and everything. So
wait. Give us a second, guys.
We're trying to get this all up here. Oh, you can't hear us? Technical difficulties.
Hello? No? Can you hear us? Hello?
Got it?
No.
Oh.
Sorry.
Oh, she's trying to
Hey,
get
guys.
us on her radio show.
Welcome to
right.
the Wellness Radio, guys. Sorry we had some technical difficulties right there. But we are the Wellness Radio. We are here for our second hour, and we're talking about all things gut and acid reflux. So...
That was great. Oh, my goodness.
Yes, so all things acid reflux here, all things gut health. And the reason why we're talking about this is, thank you, Kelly, on Facebook. They're saying they can hear us.
Oh, you can hear us. Okay.
What we're going to be talking about is how do you start with your gut? Okay, so for the second hour, we're going to talk about the resolutions. The first hour, what we did is we talked about why this is a problem. So just a quick recap. If you're tuning in and you're like, whoa, the second hour, I didn't know these two cool doctors are going to be on this hour, because there's usually crappy syndicated shows during this hour or local shows, but we're here now. This is our second hour now. So if you're first tuning in, what you need to understand, just a quick recap, is that your gut issues, if you have gut symptoms, acid reflux, constipation, oh my gosh, how many people are not pooping regularly? You got to do 1 to 3 times a day. And some of you guys are going every couple days. If you're not pooping, you're not getting toxins out. You're not getting estrogen out. So for men and women, it's going to wreck your hormones. You're not eliminating. And if you're not pooping, you're not properly absorbing your nutrients. So if you're having constipation, loose stools, if you're having acid reflux, if you're bloating and all these things, that is a red flag. It's a tip of the iceberg that what's going to happen is you're going to have gut issues, and it's going to lead to things like Alzheimer's, dementia, autoimmune disorders like MS, and skin issues, depression, anxiety. The gut, what we know is it has this back and forth relationship with the immune system, which means the immune system grows out of the gut. And in order for your immune system to be strong, for all of you guys afraid of COVID, or maybe you're not afraid of COVID, whatever it may be, your immune system is strong because the gut is strong. And then your immune system helps your gut be stronger, and it has this relationship. Okay, the second thing is that you can have gut issues and not have gut symptoms. Another way that gut issues can start is eczema, skin issues, hair changes, thyroid issues, testosterone, estrogen issues, autoimmune issues, gout, and those types of things, like
low vitamin D, vitamin D deficiency.
Yeah, so all of that, guys, you can have systemic issues and it be a gut problem and not have gut symptoms.
Yeah.
The next thing you guys need to understand is that your colonoscopy is going to identify a disease that's already there. So why is it that when we coach people and they come in and we do the right stool test, what we find is they have serious issues, but it didn't show up on their colonoscopy? Well, it's because those serious issues will persist and will cause an imbalance, so that next time on your colonoscopy or the next time after that, you will have issues like ulcers and polyps and signs of precancerous cells. Guys, let me go ahead and point this out about precancerous cells. Everyone has precancerous cells. When I have someone that comes in and they're like, my doctor found precancerous cells, we all are able to make precancerous cells. But what usually happens when they find precancerous cells in the gut, or you might find it in your ovaries, your uterus, and all of this, what is usually the thing? What do? Wait and see. What are you waiting for? For it to become cancer, for it to become something, so that they can treat it. But precancerous, we're all creating cancer cells in our body, and our body's meant to break it down and kill it off. The problem is, why doesn't it do it? So that the colonoscopy is finding disease early on. What you want to do is not get to a point where you have to identify and diagnose a disease and then have to have aggressive treatments. So when it comes to your gut health, the biggest thing, and the last thing is this: going and buying a probiotic for a majority of you guys ain't gonna do crap, because your problem is so layered and it's deeper and all of that. So that's a lot of the pointers that we talked about the first hour. If you're like, who are these doctors? We are Doctors Warren. You can check us out on doctorswarren.com. I can see you guys are checking out our website. Look at the testimonials. Look at what we have on there. And you can even schedule a consult on there, or we have a team member standing by if you're interested in checking out what it would look like to work with us. But that's the first part. Now, this part we're talking about, how do you start to chip away at your gut issues and get better?
All right, so let's dissect it then. So one of my favorite ways, and I do this with just about every patient that comes in, and those patients that are listening to this, you know this. For the most part, I push people at the beginning of care with their diet to go more towards a ketogenic diet, just to make sure metabolically you're healthy. Because if your metabolic health is off, so is your gut, so is everything in the body. Like, we know that again, if your metabolic health is off, it affects your mitochondria. If you have mitochondrial issues, you will be a candidate for heart disease, cancer, diabetes, everything. So the first kind of step for me, and from a dietary standpoint, is I start moving people away from actually some of the things that feed overgrowth, they feed dysfunction in the gut, like the sugars, like the rancid fats and the bad seed oils. I start moving them away from those things, and I start supplying, because here's what's cool: what supplies a cell, right, for fuel, also supplies the gut, right, for its gut, for its mucosal membrane, for its feeding good bacteria, for getting rid of bad bacteria, all of those things. So That's where I start.
And I wanted to note something, though, because you said something about ketogenic. A majority of what your neighbors are doing and what your people at church are doing, your Facebook friends are doing, they're doing keto in a really horrible way. They're not doing it in a way to heal hormones. And there's a few ways you can know this. Is because if you're doing keto and you can't come off of it, you never did it to heal your body.
Yeah.
If you're buying tons of things that say keto on it, if you're going to stores or restaurants and they're saying this is a keto meal, a majority of the time it's not healing. Okay? And I just want to share this thing, and then I have someone that I'm coaching right now from out of state, and she said she did keto and she lost weight. What? I can get you to lose weight and eat crappy food. Just get rid of bread. A majority of the people are losing weight on keto because they're just not eating at fast food restaurants or they just eliminated really bad bread, right? Like, if you restrict your calories, you can lose weight. Anyone can lose weight if you're eating less calories. At the expense of your health, at the expense of your hormones. But I had someone come in. She was like, man, I did keto and I would lose weight and then I would get stoled. And there's a reason for that, but you can touch on that. But I'll never forget, she said, but the problem was, even though I was losing weight for the first time, I was having skin issues. Like, my skin was getting cracked to the point where, like, they would bleed. So keto just wrecked my body. Keto wrecked my body. Keto did not wreck your body. The way you did keto wrecked your body. But why was her skin issues flaring up? Because she was doing freaking dairy. Yeah. A lot of you guys think that keto is a ton of milk, a ton of cheese, and that's going to wreck your gut. So you lose weight, and you're going to wreck your gut. So when you come off of it, it's just not going to be sustainable. So that's a perfect example. I had to talk to her about how she did keto was completely wrong, and the reason why her skin was having a reaction and flare up is because her gut was overwhelmed by the crap that she was putting in it. Yeah,
and I would even argue that when trying to heal the gut in general, like, dairy should be eliminated for the most part. And then there's, I'm not saying that all dairy is terrible, because there's some superfoods that you can have with dairy, but if the digestive system and the body's not ready for it, it can be a very highly inflammatory food. And even if it's like, at the beginning of somebody's kind of gut journey, like, even if it's raw, pasture raised, the most amazing farmer on the planet that raises his cows or his goats the way he should, at the very beginning of a serious gut issue, I find that all dairy is just harsh on the gut. Now, and again, so once you start getting and reestablishing the health of the gut, then we can start adding back in, because I do believe, like, I think if we were going to identify with, let's say, a certain diet that we consume, I think we would identify more along the lines of, like, Weston A. Price type of stuff, where so kind of a more, that's a good way to put, like, a paleo Weston A. Price type diet. But I have some people that, like, I've seen people say, go ahead.
Well, I was just going to say, because I just wanted to address, like, the paleo thing. I've heard people be like, like, oh, I can't do paleo. Or, like, I had someone ask, like, I can't see a doctor that does paleo. Well, but paleo, all that means is just going back to the way our ancestors lived and ate. That's all that means. Yeah. There is nothing to it. We use paleo because paleo has been around long enough that now if you go to the store and you see paleo on an item, you know for a fact it's good enough and nutritious enough for you to eat. That's the only reason we use it. Food. But it's easier to say paleo than to say food that's organic, animals that are out in the sun, animals that eat grass, animals that are not tortured before they die, no pesticides, it's easier to just say paleo. I just want to say that.
I completely agree with you. And even in the realm of keto, so, like, people are going to do it differently, right? Like, so I may have a man who's suffering with psoriatic arthritis that I lean him more towards a animal forward ketogenic diet, where the majority of what they're consuming is, animal protein, animal fat, collagen, bone broth, and I'm leading them more towards that route and see amazing results with them. And then I may have somebody that, a 45-year-old woman that's, got breast cancer that comes in, and I lean them more towards a plant-forward ketogenic diet, where they're consuming, high amounts of cruciferous vegetables and leafy greens and getting tons of nutrient density in there. And I may have them doing more like wild-caught fish and that route, and see, again, really great results with that. So within the realm of ketogenic, really all we mean by that is you're eliminating the sugar, right? You're eliminating, a carbohydrate toxicity. And when you eliminate that alone, you start to take away the majority of the fuel for your overgrowth in the gut. Just like that. And then on top of it, like if you do a ketogenic diet the right way, most of the time, it's going to have a good amount of things like antioxidants and polyphenols in it that are actually great, help to feed things like good bacteria and again, proliferate that. We also know when you cut out the carbohydrates and the sugar, guess what else you start to starve? Things like yeast overgrowth, and you start to see, again, improvements in that realm. So that's why, for the most part, I like to start in that realm there, right? And that's kind of the first foundation of from a dietary standpoint, to get into gut stuff. So what I don't do is I don't just say I want you to go gulp these huge jugs full of fiber, because you heard that fiber is amazing for the gut, and again, there's even arguments on the other side that, hey, you know what, fiber may not be as needed as we once thought it was, because your body can actually turn short chain fatty acids into actual food for bacteria to grow, I think butyrates to grow bacteria. So that being said, sorry, I don't fully buy into the whole fiber thing. I think fiber can be important, but I don't think it's always necessary. I think variation is necessary. So at least starting in that realm is a good pathway to go down.
But for you guys, depending on where you're at in your health journey, and that's where we meet people at, whether you're the beginning or you're the advanced. So a lot of that is more advanced stuff, right? Like, this is how we coach people from where they're at and take them to the next level. So if you've already been eating, more nutritious, nourishing foods, we take you to the next level, right? But for a lot of you guys, you might be starting off with drinking a lot of Coca-Cola or eating a lot of fast food. And the truth is, you're overcomplicating it. Having to jump into Whole30, having to do the keto, having to do this. A lot of you guys, all your body needs is nutritious, wholesome, nourishing food. All you need to do is take the pressure away of having to diet. And what you need to realize, and if you viewed your body as the amazing temple that it is, what we know about science is that our body was created to heal. It's remarkable. What we know to be true is that your body's never going to do anything to harm itself. So if there's something that looks like the body's failing you or hurting itself, like an autoimmune issue, then you need to take a step back and realize, number one, my body's never going to do anything to harm itself. It wants to stay alive.
It only adapts.
It only adapts. If bacteria can adapt, the simplest thing is bacteria, although they're not very simple, but if bacteria can adapt to the medications that we as humans think that we're developing and going to save the world, if bacteria can adapt to that, you think bacteria are smarter than our bodies? Listen, what your body needs is clean fuel. What your body needs is to start eating in a way that you think, I said this during the break, if I had a Ferrari, I'm going to put the good gas in it. I got this amazing body that's going to take me to the last day here on earth. What I know is that it needs good fuel. Just go from eating processed to eating basic. I will never forget, we're about to go on break, spoke with your uncle, your great uncle in Mississippi. He was complaining about why is it that now no one can eat pork. I ate pork all the time growing up. And I'm like, okay, where'd your pigs come from? Oh, well, we had pigs in the yard. And then we took it down to the butcher. That's it. Go back to how our grandparents, who didn't have to say organic food, how they ate. Just eat food, less chemicals, less pesticides, herbicides. The animals that get to be outside, they get to see the sun, they get to eat grass. That's the first place to stand. And then when you get better and you see results and you're like, oh my gosh, I keep on wanting to get better, then you take it to the next level, what you talked about, eliminating those carbs and increasing that. I mean, you can do that even from the beginning. So that's the first place you've got to start, is you got to remove being bombarded by crap so that your gut can start to heal, because your body heals it. So if you're listening to this is the Wellness Radio. We're about to go on a break. We have a clinic here in Hamilton Place, and we do virtual health coaching. If you want to look into setting up a consult with myself or Dr. Nathan to get down to the cause and start healing your gut, healing your pain, healing your hormones, go to doctorswarren.com. You can schedule a consult there or give our team a call right now at 423-362-5360. Again, that's 423-362-5360. And we'll see you right after the break.
All right, guys. So, again, hopefully that gives you guys a place to start dietary-wise and food to consume. Now, the next thing that I think is going to be important as we move into, you know, these later segments is understanding how important it is for you to give your body time where it's not getting food. So we just talked about how we had some patients that went through a fast, and one of the things that I went over, and I've gone over in a lot of different videos that we've done on our Facebook or on our radio shows about fasting, is that you give the body a chance to kind of reset its microbiome. Now, it's so many layers that, yeah, it's going to take multiple fasts over time, not in a row, but over time to see some of those gut issues happen. But we know even within like the 24 to 48 hours of resting the gut, you start to like turn over the cells in the gut lining. So you're already starting to give yourself a new gut lining, which is amazing. We know that, you know, on a more extended fast, you get rid of old, mature immune cells, and you're able to create new immune cells. So especially those of you guys that suffer with autoimmunity, fasting should be in your regimen on a regular basis, and making sure that you're getting that in. But also too, like, it just makes sense to give the gut a rest sometimes. You gotta let the body clear out its junk. If it's constantly working 24/7, 365, you know, it's just not gonna end up with a good result, right? We've got to make sure that we're giving the gut a rest from time to time. This is why one of the simplest ways to do it, and yet I still see that either people just choose not to, or they struggle with it, because I feel like every human being in America has heard of intermittent fasting at this point, and I still can't believe that there's still a lot of people that don't do it, because it's one of the most simple ways to rest the gut, at least on a regular basis, and allow it to move in the right direction there. Also, too, on a multi-day fast, like some of our patients just went through, they gave a good opportunity to just get rid of a lot of overgrowth in order to re-inoculate with good bacteria, right? All right, guys, welcome back to Wellness Radio. I am your health expert, Dr. Nathan Warren, and I'm here with my beautiful wife, Dr. Rebecca Warren. We've been talking about gut issues and specifically in the realm of, like, you know, reflux and gas and bloating. So we're kind of working our way through this. We talked about, you know, the dietary side of things. Here on Facebook Live, I was also talking about knowing when to give the body a rest and giving the gut a rest and not consuming food all the time. You know, the average American's eating anywhere from like 17 to 23 meals a day, and you say, well, no way, that's impossible. Mm-hmm. No, it's every time you put food into your mouth,
or
right?
Liquid.
Or even, depending on the liquid that's there.
It can be coffee. Oh, yeah. No, it's definitely people's coffees too, because they put those
it's
creamers
all sugar
and
creamer
stuff. Yeah. Sodas, teas.
Yeah, everything, right?
Gum, candy, a cookie, a bite of cookie. Like
biscottis.
Well, the thing is, like, what I always
what are those things people that I always look at them like those are disgusting.
They're so good if you dip them in coffee. They're so good.
Oh no way.
They're hard and crunchy because they get soft. Anyways,
it looks like bread.
I digress.
Left out,
that's the point. That is the beauty of biscotti.
That's gross.
Crap. Because I wanted to mention that, because when I coach people, what I always hear is this. Well, I don't know, because some people are not back in their office. They'll be like, there's always something at their offices. There's always like cookies there, or someone brings cake or something, and they're like, well, I just had to have a little thing, and I'm like, yeah, that little bite is still like eating.
Oh, it's eating. Yeah. Oh, absolutely. And it'll spike your blood glucose, and it will have an insulin response, and it definitely counts as a meal. Like that's why one of my least favorite things on the planet is snacking.
It's biscottis, apparently. The worst thing in the world for you are biscottis.
I just think they're weird.
We've been married 7 years, and I just found out you don't like biscottis.
I wouldn't eat them anyway, but they're just weird. Like it's like if somebody was gonna hand you like a stale bag of chips or something.
But
like,
it's
here,
not.
and give it a fancy
in
name
coffee.
for stale bag of chips. It's like, come on, I'm not gonna eat that. It's so
we
weird.
gotta talk about this after the show.
And then they sell
I'm
it
gonna
for
have
more.
you try it.
It's actually
anyways.
oh my goodness. All right, so that being said, right? Like I do think that I lost my train. Where were we at? You
Snacks.
distracted me. Oh yeah, snacks. The only little human beings on the planet that can do that are, kids. Like, I do think there's a point, especially when kids are little, like where they can kind of graze, as long as we're talking about real food, right? Like, fruits, nuts, seeds, good healthy meats, vegetables, those type of things. I do think that kids can kind of graze and snack, mainly because have you ever seen a flippin' 3-year-old or a 4-year-old? They don't ever stop. They're constantly using their brain. They're constantly learning new things. They're interacting with their world. They're running around. They're wrestling. They're fighting. They're doing all these things. Time. Yeah, you can tell we're talking about our kids. And so, in that standpoint, they're burning it. Like all their glucose is going to their muscles, it's going to their brain, they're burning it off. Now, if they were eating Oreos and cake and chips and like these stinking crackers and all this kind of stuff all the time, now we got a whole nother problem. And now we're talking about like, childhood obesity epidemic and, juvenile diabetes epidemic. But again, I'm talking about real food. But as an adult, that's just not the case, because most of us in our society, in our world, are not, running on a regular basis, or, walking everywhere on a regular basis, or have a physical job. Most people are sitting at a desk all day. Like, even like I used to have, a lot of patients in our office are teachers who used to walk around quite a bit. Guys, now as a teacher, you might sit even more because you're on Zoom all the time and you're doing these type of things. Like, guys, if that's your lifestyle, again, you're in big trouble, because if you combine that with snacking all throughout the day, you will develop diabetes. There's no way around it.
But this is the thing. Not necessarily diabetes. You will develop a metabolic issue. Yeah. Because it doesn't just show up as type 2 diabetes. It can be an autoimmune issue, which can lead to type 1.5. It can be PCOS. It can be issues with converting thyroid. It can be Alzheimer's, dementia. So let's clarify that, because it's not that everyone's going to get diabetes, but everyone can get a metabolic issue. It doesn't matter if you're skinny or overweight. Yeah. And I have a question here I think would be great to answer here. So you talked about taking a break from food. Would you always consider like just doing water during that time, or because people do bone broth? And why use bone broth?
Oh yeah, I mean, I do think, especially in the realm of the gut, I like bone broth like fast. I think that they're amazing. I think you should do it this way though. Like if you are going to utilize time away from food and you're going to actually fast with bone broth, I think hitting like a 2 to kind of 5 day fast with bone broth is a great idea. If you're not going to do that, I would rather you not drink on bone broth in the morning. I'd rather you wait till like before your first meal and before dinner, so that it's still within your eating window and you're still fasting. Because if we're talking about intermittent fasting, like part of the reason we're doing that is to also trigger autophagy, which is breaking down damaged parts of your cells, and mitophagy, breaking down damaged parts of mitochondria. And so that being said, we want to give the body the opportunity to do that, and bone broth contains amino acids in it, so it's building, right? It's repairing, it's doing that work. So I would rather you not intermittent fast with bone broth. I would rather you consume it in your eating window. So consume, if you've got gut issues, or you're just trying to help the gut, be as healthy as you can. I think a really great practice is like, getting at least 1 to 2, cups or mugs of bone broth a day, like with your meal or before your meal. Watch how much less you eat too if you drink, a cup of bone broth before your meal. And then if you want to do more of a fast, then take 2 to 5 days and rest the gut, fill it with bone broth. That can be an amazing, I've seen like absolute game changes with that. Even taking that and then somebody doing something as simple as like L-glutamine powder, Like, do you remember in the chiropractic school, that was one of the things, Dr. Rebecca was having some gut issues. I remember, like, you just couldn't break down food for some reason. I don't know if you had gotten, like, maybe some food poisoning or something, but, like, you had just hit a point where it was, like, you couldn't keep anything down. And the only thing that got you out of that was bone broth and L-glutamine. Those two simple things right there, started to repair the gut. And if you're going to take L-glutamine as a supplement, I would do around 4 grams a day. So, quite a bit. So you're doing 4 grams of that in bone broth. But don't intermittent fast with bone broth. Consume it in your eating window to get the benefits of autophagy and then the benefits of the gut health, or take time 2 to 5 days to do a bone broth fast, which that's what Miss Pat did this time around, like during our fasting, because she had never done one.
This is her 3rd fast.
Yeah, and you know what happens? It's the same thing that you had talked about, doing a bone broth fast for like 5 days. Everybody does it the same way. First 2 days, you're gung-ho about drinking bone broth. You're like, oh, this is great. Like, I'm not, I'm full. I'm not. And then the last 2 to 3 days turn into a water fast because you're like, oh, I'm so sick of bone broth. Like, I don't want it anymore.
Let's go and talk about Pat.
Yeah.
Because Pat, I think, was it from the radio show or from our Facebook page?
Yeah.
Came in for back pain. Her story, we did a testimony video on our website, drswarren.com. Pat came in for back pain. She just wanted to be able to work without pain. And then what happened? Her life transformed. Yeah. She's lost weight. This is her 3rd fast with us. She's been with us now for wellness.
In good weather, she bikes like a crazy person. She
which
loves
she
the
couldn't
bike.
do
Yeah.
before.
Mm-hmm.
And it's always so funny to me. I love it because we don't leave you where you're at. You come in for pain. It's like, do you really just want to get rid of pain? You want quality of life. That's why you want your pain to go away.
Yes.
You want increased quality of life so you can do the things that you want to do, so that you can do the things you love. And when you start to feel better, you want to keep on getting better. And that's where Pat is. And every time I hear her doing one of the fasts with us, I'm like, oh, Pat came in to see us for back pain. And that can be for you guys as well. So if you're listening to this, you're like, you know what? I'm ready to take my health to the next level. Like, I want to get out of pain, or I want to talk to Dr. Rebecca about the thyroid because I am a thyroid expert. I want to talk to Dr. Nathan about testosterone and all of that. Guys, this is your chance to make an appointment with us. You can give us a call at 423-362-5360. Again, that's 423-362-5360. Our team member is standing by to discuss with you about setting up a consult, and you can find out more on drswarren.com. Mm-hmm. And you know what I was thinking as we go into this more, I'm just going to put this out there. If you're listening to this, because we've never really done this for the second hour. If you're listening to this and you're like, man, I have a question about nutrition. I heard my doctor said not to do this. Or I read this article about this. I heard keto is bad. All this different crap. If you have any questions that you want us to address or debunk or help you with, give the studio a call at 423-267-1023. Right? Okay. Yeah, 423-267-1023.
Or ask on Facebook Live.
Or ask on Facebook. Go to our Facebook page, Dr. Warren. So if you don't want to put your voice on the radio show, go to Dr. Warren, DRSWARREN, and ask your questions. And as Dr. Nathan is continue to explain all this stuff, we'll throw your question in there and get that answered for you.
Yep. So now we've talked about diet. We've talked about the foods to eat. We've talked about not to eat, right, and taking some time away from food. And again, my favorite way to do it is on a daily basis. Through intermittent fasting, and really getting some fasting techniques in there. I think that as I know we got to go on break here, but as we come back, we're going to start diving a little bit more into, what are some of the specific, nutrients and herbs and things that can actually work on moving the gut in the right direction. I think we should also talk about when are probiotics important, and when are they necessary, and when can we see really good results with them, and then also when can they be harmful, right? Like, I hate to say it, but is there a time that maybe kombucha is not the best thing for you? Or maybe sauerkraut should be avoided for a little bit? And the answer to that is, yeah, there's a time for that. And so we'll get into, maybe who that's good for, who needs to give it a break for a little bit, and the why behind it. But like Dr. Rebecca said, if you guys, if you want to come and see us, either myself or Dr. Rebecca in office or via Zoom, again, we do it that way as well too. If you want to do that, give the girls a call, 423-362-5360, and they can get you set up with a time in order to sit down with us and go through your health history and break down, really where you want to go, what are your health goals, which is always my favorite part of the consult, because you start to see that little bit of excitement where they're like, oh yeah, now I'm thinking about what do I want, not what do I want to get rid of, like what do I actually want for my life. And that's a fun part. So if you have those, if you want to do that, 423-362-5360. If you have questions, like Dr. Rebecca said, you can call into the radio show. That's 267-1023, or go on Facebook right now. We're live. We're talking about all things gut health right now, so you can ask there. This is Dr. Nathan Warren with Dr. Rebecca Warren on Wellness Radio. We'll be right back after the break. All right.
So we have a question. If you're detoxing with biocidin or cytodetox and binder, is it still okay to fast during that time?
Yeah.
Biocidin not.
Yeah, well, I mean, I probably would, yeah.
It has more of a sweeter taste to it. Cyto and bind is fine.
Yeah.
But not biocidin.
Yeah, the only reason I would use biocidin, I think, during a fast would be if I'm trying to really kill off. Or that would be tough on a person.
No, a biocidin, I wouldn't use biocidin for that.
For a fast.
Also, it's the liquid form. I wouldn't. Maybe if you had capsules. But the thing is this, what I have found is that, okay, so intermittent fasting came around, and although you might have a different idea with Bulletproof Coffee after you've listened to them speak about it, but what I found is that intermittent fasting was huge, and so what people started doing, and what people started doing is they started like doing Bulletproof Coffee, but then adding collagen and then adding all this other stuff to it. Or I have people that even nut pods, but what they don't realize is that their body reacts to certain things. Like you might be sensitive to the type of coffee you're drinking or the creamer you're using, and without you realizing, you have increased glucose after consuming it, which increased glucose is a meal. That is considered. You are not intermittent fasting 16 hours. So, I mean, I'll be honest with you. I have done this. I've tested when I drink black coffee, my glucose does not change. So I can drink black coffee during my fasting window and I'm fine. But when I do add a little bit too much nut pod, which is what I like, my glucose will change. So I know without a doubt, if I'm drinking nut pods in my coffee, then I will be out. It's not fasting. So I try to push it as later as possible.
But yeah, but the cytodetox and the binder is an amazing thing to take while you're fasting. Because when you fast, you kick out toxins. The more toxins that you kick out, the body can get overwhelmed, and then you redistribute toxins. So utilizing systemic binders and gut binders grab onto those toxins and eliminate them really, really well. So Mallory, from that standpoint, those are two of my favorite things to use when fasting are cytodetox and in either bind or some other type of charcoal or humid fulvic acid type binder. So I think that's a really great way to remove a lot of toxins. When you fast, I mean you upregulate glutathione production that helps you kick out toxins. I mean you are really vamping up your detoxification mechanisms, which is pretty awesome. With the other thing, as far as gut goes, like when you fast, again, for most people, I don't really see the need, especially if we're talking like more long-term fasting, I don't really see the need to supplement for the gut because your body's going to naturally kind of break down damage in the gut. Now, I have seen some kind of cool things with, utilizing something like WOB enzyme, right? Like systemic enzymes can also break down biofilm in the gut. At the same time, they're breaking down inflammation. So that's kind of a fun thing that you can use. So if you're somebody that's suffered with inflammatory issues, you could fast and use something like WOB enzyme and see some good results there too. So. All right, guys, welcome back to Wellness Radio. I am Dr. Nathan Warren here with Dr. Rebecca Warren. We are talking all about gut, specifically in the realm of what's creating all those pesky symptoms, that reflux, that bloating, that gas, the constipation, the diarrhea, the going back and forth between constipation and diarrhea. I always like the rule that Dr. Goldberg, who was our nutrition teacher in when we were getting our doctorate, which, by the way, he's like world renowned he's
well,
awesome,
he
man.
reversed rheumatoid arthritis
Yeah.
decades ago.
And he was fasting before it was the cool thing to do.
Yeah, I remember when we were in school and we learned about it. He'd be like, I would fast every Monday. He'd been fasting every Monday for years. And I was like, he goes a whole day without eating for years. I don't think that's safe.
Like,
I don't think that's
insane.
good for him. This guy that reversed RA and helped women and men get their health issues. I was like, I cannot believe he's fasting. That's not safe.
Yeah, he was also the first one that introduced us to Weston A. Price and like his work. And I mean, he was pretty monumental in at least my opinion with the way I view, nutrition and stuff. But anyway, he would tell us this: when food comes in, something should come out pretty soon afterwards, right? Like, as something comes in, something should go out. That's kind of the natural process of things. So if you're eating 3 meals a day and you're only pooping once, there may be an issue there. That may be a problem. If you're eating, 7 meals a day and you're pooping 7 times, well, maybe that should clue you in that you don't need to eat 7 times, because maybe your body's doing what it's supposed to do by pooping 7 times. But again, it should clue you in that that's way too many meals there. And again, that's a great way to, become a diabetic or stay a diabetic, is follow the American Diabetic Association. Actually, I gave my men's group a really cool study, and I just want to mention it really quick because I didn't even realize this study existed. I believe it was a Spanish study, and what they did is they followed individuals over the course of, I think it was 5 years, and they did a Mediterranean diet that was a low fat Mediterranean diet. Then they did a Mediterranean diet with olive oil, and then they had a group do the American Diabetic Association's or the American Heart. It was the American Heart Association's their kind of deal. And the other 2 groups just blew the American Heart Association out of the water, so much so that they shut down the study because they realized that the people that were eating the way the American Heart Association recommended, it was unethical. That's what they concluded. Like, eating the American Heart Association, like the way they said to eat, was unethical. So they shut down the project, but then they kept the other ones going. And the group that consumed, like, the Mediterranean diet and the olive oil had like memory improvements on top of it and everything.
Didn't they do something like that too with you probably remember the details where what was it that, like, if you suffer from seizures or something, like, and keto can help you. Is this someone we know that happened to, or what did they tell them? Like, you have to try.
Standard of care was 4 drugs.
So you have to have failure of 4 drugs before they could put this kid on the ketogenic diet to help with the neurological issues.
This stupid stuff, man. You can't even make it up. We had a question. Can you type or spell the enzyme you're saying? Wobe enzyme. You nailed it. I think that's it, minus the E. I think that's it. Yeah.
You can go to our Doctor's Warren to our Wellevate store and just put WOB and it'll pop up.
Yeah.
So,
and again,
doctorswarren.com
you can get a higher quality one there too, because most people just get the regular Wobe enzyme, and you'll be taking 12 tablets a day, as opposed to the professional strength, and you can stick more around
2 or 3.
Yeah, and get a much better result that way. So, all right, so we talked about, the kind of the foundations of what to eat. We talked about why you need to have periods of not eating, right, and fasting and incorporating that into having a good, healthy gut. Now let's talk about some of the things that we found to be, game changers in the gut. And one of those can and may not, it can be the presence of probiotics or the absence of probiotics. It depends on the person. Right? So, like, let's give you an example. If you're somebody that suffers with bloating and reflux and gas, I would go, I would go ahead and steer in the clear there of probiotics. I'd say, you know what? I'm not going to consume probiotics. I would probably stay away from fermented foods, because more than likely that is an overgrowth issue. It's an overgrowth issue. So, does that mean that the bacteria and probiotics are bad? Does that mean that the fermented foods are bad for you? Absolutely not. But what we do know is that it's something that over time, again, will feed, that overgrowth. It's going to feed whatever's in that kind of upper intestinal area. And so the best results we get when we're dealing with somebody with overgrowth is I get them off their probiotic. And some people have been taking their same probiotic for literally years, and so you're getting the same cultures of bacteria over and over and over again. So if you knew how diverse the microbiome is supposed to be, you would not continuously throw the same bacteria in it over and over and over again. And then also too, most of the probiotics that people are taking don't even make it to the gut to proliferate. Like if you're taking a capsule form of probiotics that is not, like, let's say in its spore form, you could take 80 billion CFU of bacteria. You're probably getting maybe 1 billion to 2 billion that make it to the gut to actually proliferate. So, that's one of the reasons I'm not initially a fan of utilizing probiotics. Now, there are certain cases where probiotics may be good. Like I know, like when you're dealing with something like you have somebody with like irritable bowel syndrome or, something like ulcerative colitis, utilizing some of those spore form probiotics can actually be like healthy and can have some good results there. So I know there's a time to use it, but for the most part, if you can start the process off like away from bacteria and then use that as a later on type of thing where you start adding in different types of bacteria, I think you're going to get better results.
Absolutely. So it's supporting it. So far what we've talked about is kind of like at its most basic form, having the right nutrients, having the right support system, getting the right fuel, clean water, clean air, clean food. That's
actually water is a big one too, because a lot of people that eat healthy and work on their health still haven't changed their water source. So you're still getting fluoride, chlorine, things like that.
No, that's completely right. Mm-hmm. So clean water, clean air, clean food. Then what you can grow onto that is, okay, now you can diversify how your metabolism functions, burning fat for fuel versus sugar for fuel, which gives your gut a break. Then that next level is implementing fasting, utilizing fasting to heal the gut and to allow the body to heal itself. And then that next level is what we just talked about. How do you properly re-inoculate what's going on in your body? And so what I want you guys to realize is that the gut microbiome is amazing. It's powerful. It is unbelievable that medicine, that science thought that they can throw whatever the crap they want at us without fully understanding our bodies. Let me go ahead and tell you, science will never, ever, ever get caught up to how the body functions and works. We will never fully understand it because it's a powerful thing that you can't put a finger on, right? So the fact that now studies are saying, oh crap, over-the-counter pain medication, like what is it, Advil or Tylenol, will disrupt the gut microbiome. Oh crap, chemicals in your water will disrupt the gut microbiome. Oh, all this stuff. We shouldn't have to wait around for a doctor to tell us something's good for us or not, or for science to tell us that it's good for us or not. What we know is what our body needs is clean air, clean water, clean food, and a properly functioning nervous system, because without the proper function in the nervous system, your body can't do crap. Yeah. And so when it comes down to it is that unless every day you're working towards that, unless every day you're decreasing your exposure, unless every day you're working towards clean water, clean air, clean food, and a properly functioning nervous system, unless you're working towards that, you will have issues. And when I say properly working, nervous system, guys, concussions. Some of you guys have had whiplash accidents and you were just hit at a stop sign. I mean, studies have found that within 30 minutes of a concussion, there's complete gut permeability in the gut. Yeah. So something happens up here to your brain
and you create leaky gut.
And you create gut permeability, which is connected with autoimmune disorders. Stress. Even they have looked at how being in a stressful environment, your brain is downloading stress, decreases your stomach acid production, decreases your pancreatic enzymes, decreases all of that, and you're not absorbing your food. Yeah. So clean air, clean water, clean food, and a properly functioning nervous system don't make it harder than it needs to be, but what you do have to understand is that it's going to take time.
Oh, that's good.
It's going to take years of commitment.
You mean you can't change your microbiome in the skin in the digestive tract, in the urinary tract, even within a couple of months, you may see some improvements, but no, it takes time. You're talking about resetting your microbiome. And what I found is in adults and kids, there are so much overgrowth that has that's deep in the biofilm, or it's resistant, right? Like a lot of resistant bacteria. It takes months, 4 months, 6 months, a year. It takes time to reset. It doesn't just happen overnight, and it can't happen overnight because we're talking about, like you said, an intricate system. And for a lot of people that has been damaged really since birth, so Absolutely. it takes time. We have to be patient with that healing process and not get caught up in the medical ideas of saying, oh, it's gonna get rid of this symptom in 2 weeks.
Absolutely. So guys, we have to go on break. This is the Wellness Radio. If you'd like more information about scheduling a consult with us, give our team a call at 423-362-5360. Again, that's 423-362-5360. We're local here in Chattanooga. We have a clinic in Hamilton Place. Or we do virtual consults all over the U.S. This is the Wellness Radio, and we'll see you right after the break.
All right. So, time. Man, I get fired up with that one because, again, I fall into the same category just like everybody else, where sometimes if I'm dealing with a health issue for myself, I want it to be gone tomorrow, right? But it doesn't work that way. And it's like, every now and then I'll have, and mostly in the past, I don't really have them anymore, but in the past I'd have patients that they come in for low back pain and they're like, oh my goodness, even though I showed them a 32-degree scoliosis in their lower back, they're 3 weeks into care and they're like, man, I've still got my back pain. I just don't know if this is working. I'm like, dude, you've had damage and a scoliosis curve for 32 years and you want your back pain gone in three weeks. Guys, that's not the way. Our health doesn't work that way. I'm sorry. It just doesn't. But we have been brainwashed into thinking that's the way it's supposed to work, because you can have reflux, like one of the symptoms I put on the show. You can have reflux. Your doctor can give you a PPI and your reflux goes away in a day. So and you're like, oh, this is good. Yeah. But then your risk of cardiac event goes up by over 90% if you're taking that PPI for longer than 3 years, which most people have been taking it for 20, 30 years. And so you start to see there's a trade-off there. And so that's the difference between treating a symptom and treating root cause. We've got to give the body time. And everybody's time is different. So when people ask, well, Dr. Nathan, when am I going to get better? Or when's this patient going to get better? I don't know. I don't know your time. I can give you maybe a guesstimation. Sometimes I'm right. Sometimes I'm not right.
Guesstimation a real word?
No, I don't think so. But it's a perfect way of describing what I mean by it. So, time is it's the hardest, but possibly the most important health principle out there.
And don't get me wrong,
yeah,
I hate it. I'm frustrated. I hate it from the side of being a doctor, and I wish everyone could get everything completely fixed in 30 days. And even as myself, living without a thyroid, it takes time for me. And sometimes I wish I could have had things happen 10 years ago, but you know what? It's all a process.
Or I look at, oh, Dr. Nate, I've been eating this way, it's not working. I'm like, oh yeah, you're right. You should quit, and go back to eating your processed food, your sugar, your bad oils, because that's probably going to get you the results that you want, right? Come on, guys, we got to think about it a little bit better than that. It does. It takes time to get well. Now, some of the things that I think really move the dial in the gut that without, because I know everybody's an individual, without getting super specific, but I do want to give you guys some things. When it comes to gas and reflux and bloating, one of the most powerful ones that I found is something called Atrantil, right? Atrantil, Atrantil. If you go on our Doctors Warren store there, doctorswarren.com, you go to our shop, we have it on there. And this is amazing. It was actually created by some gastroenterologists who got sick of using antibiotic therapy for overgrowth, right? They were like, this just isn't working long term. It may get rid of their initial symptoms, but problems come back. And so that's one of the most powerful one I found. All right, guys, welcome back to Wellness Radio. I'm your health expert, Dr. Nathan Warren. I'm here with my beautiful wife, Dr. Rebecca Warren. And so we kind of went through, obviously the food to eat, the clean water, the clean air, the movement to get, the when to actually fast and utilize that, for the foundations of the gut. Now I want to kind of get into, some of the things that I find helpful for making sure that you're having a healthy gut. And again, don't get me wrong. I know that all of you guys, your microbiome is, you're an individual. The way that your microbiome is completely different than the person that's sitting next to you or than the people that you even live with. There may be some similarities, but you're still an individual. So if you're having gut issues, that's where you want to come in and see us so that we can actually sit down and address it like one-on-one. But some of the things that I find that move the gut at least in the right direction: gas, bloating, reflux. I mentioned Atrantil. That's one of my favorite ones to use. And you take it with a meal. I think it's 2 capsules with each meal. That's a great one. I know anytime you utilize enzymes and maybe some HCl and ox bile, with any digestive issue, the more that you help break down your food, the easier it is on your digestive system. So I think that's one that kind of goes across the board that pretty much everybody can benefit from, is breaking down, breaking down your food that you're consuming. So utilize some digestive enzymes. We like to use like some enzymes from Designs for Health. We find those work really, really well. Another thing that I find that works well for most people in the gut realm, I mentioned L-glutamine earlier. Things like licorice root, marshmallow root, especially when you combine those together, you get a really, really good result. Aloe is another great one that I like a lot. Actually, aloe in Dr. Rebecca's realm, there was one study that showed high-dose aloe actually was able to reduce and even in some cases reverse Hashimoto's, right? So looking at autoimmune conditions, and I think the primary mechanism behind that, I don't even know if it's discussed in the study, but I think it was because of what it did, to the gut. So I think that can be another one that can be really, really beneficial. And that's one that can really help, especially with symptoms of reflux or heart or you're burning or things like that. Aloe is one that can help quite a bit. And getting high dose aloe, that's why I actually like to get it in capsules, and I think you're going to get a better result with that. Things like bitter foods, right? The thing that doesn't exist in our diet anymore. How many kids are eating bitter foods nowadays? Zero. It's one of the biggest things missing is bitter foods. So rosemary, you can chew on rosemary, before a meal. You can put bitters in some water, as long as it's really clean bitters. You can use different herbs. You can use some things that stimulate that hydrochloric acid production, and see some really good results with helping to break down your food, over time. But all that being said, save the probiotics for later on. Keep them diverse when you use them, and use more of soil-based organisms, Saccharomyces boulardii, those type of things. You're going to get a better result with that, later on. So,
and I want to say, if you guys are listening to this, you're in the car, you're driving around, if you go to doctorswarren.com and sign up for our newsletter, what we send out is this recap. And if you're like, oh my gosh, we always get messages, can you send me a message about the supplements? If you sign up for our newsletter on doctorswarren.com, you can get this sent to your email so you can review it, you can watch it again, and you can see those supplements.
Yep, that's right. So if you want our information, doctorswarren.com, DRSWARREN.com, or you can give them a call at the office if you want to set up an appointment, 423-362-5360. Come and see us. We'd love to be able to see you guys. This has been Dr. Nathan Warren, Dr. Rebecca Warren on Wellness Radio, and we will see you guys next week. What'd she say? Rosie said, oh my gosh, she said my name, Rosemary. Yeah,
Hi, Rosie.
Hi, Rosie.
Hi, Elijah. I see you.
Yeah.
Are you guys behaving?
That was one of, I love the name Rosemary for many, many different reasons.
That was one
but
of the
that
reasons.
is one. I do have to say, rosemary is my favorite herb on the planet. The smell, how can you not smell rosemary and it just make you the happiest person in the world?
The Rosemary Grace was your idea, and I remember that was one of your factors, rosemary is beautiful and you can call her Rosie, and also rosemary and all the therapeutic benefits, and I'm like, I don't care about the
it's
benefits
amazing.
of rosemary when I'm naming my child.
It's amazing. And rosemary, the other reason I liked it is because as an herb, it's one of the most resilient herbs on the planet. Like, it's almost impossible to kill it, right? Like, I mean, you can let it grow, and trust me, Dr. Rebecca and I are not, what do you call them? Like, what are
We don't have a green thumb.
horticulturists?
We don't have a green thumb.
Yeah, we don't have a green thumb.
Horticulturist.
I was trying to think of that fancy word. So we're
green
not good at growing things. And like I think rosemary was one of the longest ones besides our goji berry plant that did, because it's so resilient. So I had many reasons why I wanted to name my daughter Rosemary. But anyway, that was a complete sidetrack. Sorry about that, guys.
All right, guys. So thanks for tuning in for a 2-hour show. Again, go to doctorswarren.com, sign up for a newsletter so you can get a recap of this weekend's show with all of the supplements we talked about. And we'll see you next weekend.
All right, guys. See ya.